Have you ever wondered if your body could be sending you warning signs years before diabetes? What if feeling tired after lunch, craving something sweet every afternoon, or struggling to lose weight isn't just part of getting older? What if your blood sugar is trying to tell you something? Most people believe the damage starts with diabetes. It doesn't. In many cases, the process begins long before a diagnosis. And by the end of this video, you'll understand the subtle signs your body may be giving you, why they matter, and the simple habits that can help support healthier blood sugar before serious problems develop. One of these habits takes less than 15 minutes a day, yet many people completely ignore it. I'm Dr. Elena Quinn, and welcome to the channel. If you're interested in protecting your health as you age using science-backed, practical advice, you're in the right place. Let's begin. Here's one of the biggest misconceptions I hear from patients. I don't have diabetes, so I don't need to worry about blood sugar. It sounds reasonable, but it's not always true. Blood sugar exists on a spectrum. It doesn't suddenly become unhealthy overnight. Instead, your body often goes through years of subtle changes before diabetes develops. During those years, your pancreas may be working harder. Your cells may become less responsive to insulin. Your metabolism may already be under stress. The surprising part? Most people feel completely normal, or at least, they think they do, because the first symptoms are easy to dismiss. A little more fatigue, a few extra pounds around the waist, needing another cup of coffee, feeling hungry shortly after eating. None of these signs prove there's a blood sugar problem, but together they can tell an important story. And that's exactly why today's conversation matters. Let's quickly understand what's happening inside your body. Every time you eat carbohydrates, they break down into glucose. Glucose is your body's primary source of energy. Your pancreas releases insulin. Insulin acts like a key, helping glucose move from your bloodstream into your cells. When everything works well, this system is remarkably efficient. Your blood sugar rises, insulin responds, your cells absorb glucose. Everything returns to balance. But over time, poor sleep, too much processed food, stress, lack of exercise, excess body fat, even genetics. These factors can make your cells respond less effectively to insulin. This is known as insulin resistance. When that happens, your pancreas often compensates by producing more insulin. At first, blood sugar may still remain within a normal range. That's why routine blood work doesn't always reveal the full picture in the earliest stages. Behind the scenes, however, your body may already be working much harder to maintain balance. Think of it like driving uphill. Your car is still moving, but the engine is working much harder than before. Eventually, if nothing changes, the engine begins to struggle. Your metabolism can behave in a similar way. Now here's something that surprises many people. The earliest warning signs don't always seem related to blood sugar. For example, do you feel exhausted after eating lunch? Do you get sleepy in the middle of the afternoon? Do you constantly crave something sweet after dinner? Do you feel hungry again just 2 hours after a meal? These experiences have many possible causes, but fluctuating blood sugar may be one of them. Another common clue? Belly fat. Fat stored around the abdomen is associated with an increased risk of insulin resistance. It's not simply about appearance, it's about what that fat can do inside the body. It can produce substances that contribute to inflammation and influence how your body responds to insulin. This creates a cycle. The more insulin resistance develops, the harder your pancreas has to work, the harder it works, the more difficult it may become to maintain healthy metabolic balance. Fortunately, this cycle can often be improved with lifestyle changes. And no, you don't need to live in the gym. In fact, one of the most effective habits is probably much easier than you think. We'll get to that in just a moment. before we do, let's talk about your brain, because this is where many people notice changes first. Have you ever walked into a room and forgotten why? Struggled to focus after a meal? Needed another coffee just to think clearly? Brain fog has many possible causes: stress, poor sleep, hormonal changes, certain medical conditions. But unstable blood sugar may also contribute in some people. Your brain consumes a tremendous amount of energy every day. It depends on a steady supply of glucose. When glucose levels rise and fall dramatically, some people notice changes in concentration, energy, or mood. Again, these symptoms aren't specific to blood sugar alone, but when they appear alongside other metabolic risk factors, they're worth paying attention to. And what comes next may be the most important part of this entire discussion. Because the good news is that supporting healthy blood sugar often starts with surprisingly simple daily habits. So, what are those simple habits? Let's start with the one almost everyone overlooks: walking. Not running, not expensive equipment, not spending hours at the gym, just walking. Research has consistently shown that taking a short walk after meals can help your muscles use glucose more efficiently. Why? Because your muscles are one of the largest consumers of glucose in your body. The moment you start moving, your muscles begin using glucose for energy. That means less glucose stays circulating in your bloodstream. And here's the best part: you don't need an hour. Even a 10 to 15-minute walk after lunch or dinner can make a meaningful difference for many people. It's simple, it's free, and almost anyone can do it. Now imagine repeating that habit every day, not for a week, not for a month, but for years. Small choices create big results. Now let's talk about breakfast, because how you start your morning often influences the rest of your day. Many popular breakfasts are loaded with refined carbohydrates and added sugar: sugary cereal, pastries, sweet coffee drinks, fruit juice. These foods can digest quickly, causing blood sugar to rise rapidly. A few hours later, energy drops, hunger returns, cravings begin. Then you reach for another snack, and the cycle repeats itself. Instead, think about building your breakfast around protein: eggs, Greek yogurt without added sugar, cottage cheese, or a protein-rich smoothie with healthy ingredients.